biceps femoris tendon, but this tendon to be known as the semitendinosus tendon. Right, this semitendinosus tendon, this is the bicep femoris tendon. Midway between these two tendon, that to be known as a UB40. That to be known as a UB40. That to be known as a UB40. Now, one shown lateral to the UB40, that to be known as a UB39. That to be known as a UB39. This is the lower HC point for the triple warmer. Right. Then one shown above from the UB39, that's called as a Fusi. Fusi, that means is the UB38, 1.5, UB38. So UB38 point should be applied. UB38 point should be applied towards the UB40. I just applying towards the UB40. So this direction I just applied, but now this the overall 40 points we completed. But I'll repeat once again: 35, 36, 37, 38, 39 for new tones beko. 35, 36, 37, 38, 39, 40. Now you located is the anatomical location, no chun, just as the anatomical location. But this also anatomical location. But this is the chun, 3 plus 3, 6 chun distal is the chun measurement. But now this is anatomical location. But how to locate the point? There are the two tendons. Midway between the two tendons, UB40. Then one chun lateral to this region is UB39. One chun again proximal to this region is UB38 towards the, if this the posterior side of the problem, along with that the patient having the Baker cyst or the popliteal cyst, in that condition we same points we just use it as a fire cupping points or the fire needling points. You just burn it, the needle, and then insert on that region is slowly greater than 50 to 60% that will going to melt or the dissolve that region. But this is the UB40. You remember UB40 is a wonderful point. Normally I used to write the article in that I used to mention this point. When there is the the back pain is this region, the back pain is this region, but there is no back pain. There is no pain on the spinal cord. There is no pain, but the pain is this region, the pain is this region. That condition UB40 is the distal point. That condition UB40 is the distal point. When the patient having the horizontal pain, I do have the pain in this region, even that condition also UB40 you can use the distal point. When there is the problem is on the spine having the problem, that time UB40 may not help much. So however, hope you recognize. So
middle muscles.
If there is the central line of the pain, yes, that also related to the osteoarthritis of the knee, some kind of the distension and swelling. But spinal cord having the problem, in that condition you just activate the SI3 and then UB62. SI3 you just use it, UB62. Only there is the spine having the pain, but there is no pain in this region, only the spine having the problem. Then you just select the SI3 and then UB62 is the combination point.
Region muscles.
So this muscles having the problem.
That side, right or left side, this muscles.
Latissimus dorsi muscles. If this muscles having the pain, this is the middle back pain. Even that condition, distal point, you can use it UB60. Along with that, now I am talking about that. So this is the another meridian we will see now. See, this is the as per the TCM physiology. But UB40 in the modern physiology, this is UB54. It's not the UB40, but this UB54 they says. But however, that also consider as their names are different, because as per the our theory 67 points, as per their theory total number of the points are 87 points, 20 points extra in that. So in that way they calculated, but however, hope we understand. Now we will proceed for the lateral side of the vesical meridian points. Now I think we will review these points quickly. I think I just apply on the left side to find out some of the points. So where is UB41? Which vertebra the point starts? T2. T2 vertebra it starts. T1 vertebra is a SI point and T2 vertebra is UB points starts. So please pass me the needles. Now I try to find out. Yes. Good. So this is T1, then is the T2, T2. T2 point is UB 41. So now this is the border, this border of the scapula, right? Then the point to be known as this is the accurate point for the UB41, 3 chone lateral to the spine, 3 chone lateral to the spine. This to be known as a UB41. Yes, UB41 for the second thoracic vertebra. Now third thoracic vertebra, you just see and then apply the third thoracic vertebra point. So please one by one you just keep applying the point. Yes. You just apply here. Yes. Apply here. You can see the border also. You can touch and feel this the border, right? So below that border. Now we are applying on the rhomboid major muscles. So these are the rhomboid minor muscles, but now we are applying to the rhomboid major muscles, right? Yes, you just apply here.
Yes, sir.
Yes, yeah. Six. Now you just apply the pit where it ends, that to be known as the. Now rhomboid major muscles is completed. Now you are asking me that no, so where if the pain is in this region, what to be done? So now remember these are the points are connecting to the lymphatic vessel meridian. This also to be considered as a lymphatic meridian vessel. We can consider that, but however this will be useful to treat for the pain on this condition and also affected the internal organ related disorders as well. So now UB, what point is it? UB 46. UB 46 point we completed. Then 47th point is 46 points. This is the gap, and further you just apply in this region. Which point is it? 47 Hunman. 47. Yeah, leave it. 48. 48. 49.
So it is region left from middle the spine, sir.
50. 50. Then 51. Superficially apply, otherwise no problem if she is comfortable. Then 42. Then 52. Then 52. Now 52 in each vertebra we applied the points now. 3 chun lateral to the spine we applied here, right? So 3 chun we applied the points here. This as a second lumbar vertebra, Zishi. Zishi means UB 52 points completed. Now on the second lumbar vertebra is completed. Then which vertebra the point is located here?
Sacrum.
Yes. So this is lumbar 2, then is the sacrum 2. So where is the sacrum 2 now? I try to find out. This is the filum terminale, this is the fourth, this is the third, and this is the second, right? Now the point is located on the second and then 3 chun lateral. Then come vertically below this and then apply the needle in this region. Yes. Now the 54th point is Cipion. Where exactly on the second lumbar, second sacral foramen? You come here, you just apply the second sacral foramen. Right. Now there are the 2 points. we applied 53, 52, 53 and then 54. All the 54 points we completed over this region. But now what exactly importance of this point? This is the lymphatic system meridian or the lymphatic system points as well, treating to that particular internal organs. What is the lymph? What is the lymphatic system? Yes, very good. Then also lymph is colorless fluid. It is extracted from the blood plasma. Right. So that is entering to the cells through the support of the capillaries. In this way, the lymphatic flow also very much essential in the body system. If the lymphatic system is not good, the circulatory system is not good, circulation is really good, lymphatic system is not good, then again will cause the problem of the internal organ. So therefore, you remember UB41. UB41 is the major point for the lymphatic system. Whenever there is the lymph glands affected or the lymphatic system is affected, that causes the problem is related to the lymph is not circulating in the body properly. So hopefully we understand UB41 is the great point for the lymphatic system, but all the points are governing to the lymphatic system. Now we applied 53 and then 54, but midway between the 53 and then 54, these muscles, so this from here, the muscles are going like this, and then the greater trochanter of the femur. This is the greater trochanter of the femur. From this, these muscles are going like this and then inserting in this region. Now the problem is, do you know the sciatica nerve? From where the sciatica nerve normally starts? From the L4, L5, S1, S2, S3. That means is the 5 nerves compressing way to become the one nerve, that to be known as a sciatica nerve. From where it starts? From the L4 vertebra. It starts from here, L4, L4, L5, S1, S2, S3. So from the S3, see, this is as a L4, L5, S1, S2, S3. All these 5 nerves to become forming as a one nerve and then passing on the posterior side. So inside of this side, it's passing. That indicating in between the muscles, these muscles are deepest muscle, multifidus muscles also deepest muscle, but these muscles are origin here and then inserting on the greater trochanter of the femur. So in this case, if this nerves got the impingement because of each vertebra, that vertebra is slightly, the disc got the compression at takon bani, spinal cord takon bani. When the disc got the slightly compression, because of that, that nerve which we call as a, that get the irritation. So that get irritation, that time what happened? These muscles will get the pressing to the sciatica nerve. The junction of the nerves, these muscles, piriformis muscles, it get the pressing to that nerve. Again, it causes the more severe pain. In that situation, the motor point for the sciatica nerve, motor point for the sciatica nerve, we just apply midway between these two, that point to be known as a sciatica nerve, and that means this is the piriformis motor point. This point to be known as a piriformis motor point, to be known as a midway between the S2 and then S4. Then you just activate, release the fascia in the region, but definitely that muscles will get released, the fascia will get released, then the sciatica nerve also it get eases. But you just use sciatica nerve points over this region and then want you as well, but this is the piriformis motor points. But now what happened in the sciatica conditions? We can use it. This is as a L5 vertebra, this is the L4 vertebra, this is the L3 vertebra, and L4 vertebra, no, L2 vertebra. Now L4 and then L5 and then L3. So when L4 and then L5, you can find these are the spinal nerves, yellow color called as a spinal nerves. If this spinal nerves will get the compression because of the each vertebra, in between there is called as a disc, that is called as a annulus pulposus or maybe the disc. The disc, what happened, because of the pressure of this vertebra and this vertebra, this get the compression. So once we'll get the compression, the disc what existing, that is slowly will escape from the space. So where exactly occupied, the properly they occupied, but that slowly will come out, that to be known as a this red color inflammation. You can see red color, there is a inflammation.
Disc bulge.
Yeah, disc bulge. Due to the disc bulge, it pressing to the nerve, that now get irritation in terms of the red color. Red color is indicating irritation of the nerve. So once we'll get irritation, this one, then the muscles also will get irritated on that region, because normally we should sit also. Once we wanted to sit, that time this muscle get pressing to that nerve again, so that causes the more problem. So therefore we just try to release the piriformis muscle motor point. Along with that is the L4, L5, S1, S2, S3 nerves once we release, but definitely having the positive impact in order to get the maximum recovery for the sciatica nerve as well. But hopefully along with that, you can find as a Chung Fu Inman UB35 36, UB36, again UB37 points, you just activate along with these points, but definitely having the great impact to treat for the sciatica related conditions. So please